Hi, today I want to go over some facts, not my opinion. Well, I will give you my opinion towards the end. But to begin with, I want you to understand the facts. I believe it's very important for people to understand the facts about our healthcare. And here in Ontario, we have a system called OHIP, and I believe it's important that we understand our rights. So bear with me as I go through some information from the Ministry of Health, from the College of Physicians and Surgeons, from the Charter of Rights. So just bear with me, it's very, very important. So firstly, a while back when I knew homeopathic medicine was going to be regulated, I asked some of my patients to write a letter to the Ministry of Health to ask how they were going to have the medical professionals work with homeopaths, and there are concerns that maybe that wouldn't be an easy transition. So I had some patients write to the Ministry of Health, and so I'm just going to read you part of the ending of the letter. So it was from Marilyn Wang, the director from the Ministry of Health and Long-Term Care. And so in her letter, she says, the ministry has taken steps to support interprofessional collaboration among health colleges. That would be me, the College of Homeopaths of Ontario, and our regulated body, and regulated health professionals. You may be interested to know that Health Force Ontario, the province's health human resources strategy, has identified interprofessional care as an important factor in meeting its objective of ensuring that Ontarians have access to the right number and mix of qualified healthcare professionals. So, very important for you to remember that. Next, this is taken from the College of Physicians and Surgeons, their policy statement, number 311. It says complementary and alternative medicine. It was updated November 2011. So bear with me again as I go through some of this. So in their introduction, it actually states in increasing numbers, patients are looking to complementary medicine for answers to complex medical problems, strategies for improved wellness, or relief from acute medical symptoms. Patients may seek advice or treatment from Ontario physicians or from other healthcare practitioners. Patients have the right to make healthcare decisions that accord with their own beliefs, with their own values, wishes, and preferences. Then there's a skipping part. The Medical Act 1991 states that physicians shall not be found guilty of professional misconduct or incompetence solely on the basis that they practice a therapy that is non-traditional or that departs from the prevailing medical practice. Now you have to think really clear about that, why they have that in their statements, why doctors actually have in their statements that they won't be found guilty if they don't do anything other than, pharmaceutical medicine in their practice. I have more. It's important. You need to know all of this. When patients seek care that is beyond the physician's clinical competence, physicians must clearly indicate that they are unable to provide that care. When physicians are unable to provide care directly, they are encouraged to refer the patient to another physician or healthcare provider, where doing so is in the best interest of the patient. Now, you as the patient are the one that has to decide what is the best interest of you. And so understand that policy is already in place. Then, if we go to the Charter of Rights, bear with me here. So under the Charter of Rights, it says, the Canadian Charter of Rights and Freedom guarantees the rights and freedoms to set out in subject only to such reasonable limits prescribed by laws as can be demonstrable, justified in a free and democratic society. Underneath it, it says everyone has the following fundamental freedoms: freedom of religion, freedom of belief, freedom of your own opinion. So you have to understand you have the right in Ontario to make decisions on your beliefs and on your values and what you believe in. So sometimes, now listen to this, and I am not at all putting all medical doctors in the same category. okay? Truly, truly, I believe that there are medical doctors that from their heart want to do what's best for, in their heart feel they're doing what's best for their patient. And I believe that a lot of them are under tremendous pressure, and maybe some of them would like to do complementary health or be involved with people with complementary health, but they're afraid of being of their position being jeopardized by doing that. Okay, so listen to this. Bullying. So this is from the Ministry of Education. Bullying means aggressive and typical repeated behavior by a pupil, put in whatever context you want to put in there, where the behavior is intended by the pupil to have the effect of, or the pupil ought to know that the behavior would be likely to have the effect of fear or distress to another individual. And underneath it says the behavior occurs in a context where there is a real or perceived power imbalance. Now you think about that. So what I want you to do is think about those facts clearly. As a regulated healthcare professional, we are supposed to be all working together for your patient-centered care. It is imperative that you understand your rights. Okay, very important. Now what I would like to do, and what I find confusing, is that, okay, so listen, just go back a bit. I'm getting ahead of myself. So what I want you to understand is that I feel there's a great injustice being done here in Ontario. People now, and for quite some time, have had the right to have an abortion and end a life in a newborn baby. Some people don't believe it's life. In this case, in my opinion, I believe it's a life. Now we're at a place where we have assisted suicides, or assisted suicide. And so people have the right to end their life. And both of those are covered by OHIP. Yet, we don't have the right to make our own decisions for our health and wellness by having complementary care covered by OHIP. I find that as a great injustice, an absolutely great injustice, considering that you and I pay taxes that cover our healthcare system. So if we have the right, and it's paid by OHIP, to end life on both ends before it begins and when we're at the end of our life, why can't we then, taxpayers, make a decision that we should then have the right to have the practitioners covered by OHIP, as a homeopath, as I am in our healthcare system? I want to go over some more information, because a lot of people do not understand that homeopathic medicine, I'm going to talk about homeopathic medicine obviously because I'm a homeopath, don't understand that homeopathic medicine was the first regulated medicine in Ontario. Okay? Understand that. Homeopathic medicine is medicine. And around the world, they use homeopathic medicine. I realize that some people don't believe in homeopathic medicine. I realize some people don't believe in complementary healthcare. I get it. And some people will never change their mind. But that's not my point. My point is that if you do believe in it, then you should have the right, since it's already under the College of Physicians and Surgeons in their bylaws, it's already in the Ministry of Health, it should be covered. I'm regulated. It should be covered by OHIP. So I want to go through. In Italy, they actually have hospitals that are geared to homeopathic medicine. I read the studies, and I actually went to the hospital in Tuscany, Italy, and went through how they do it. They have hospitals and they have hospital beds geared to just taking homeopathic medicine. So the results about the taking homeopathic medicine. This was a 13-year study, I believe. So it was integration of homeopathic and complementary medicine in the public health system in Italy. So the results demonstrated that homeopathy can effectively integrate, or in some cases substitute, allopathic medicine, and that the Tuscany example can be useful for the development of national or European rules on complementary medicine. So they show the stats through all of this, and I've highlighted a lot of things. So some of the things. Homeopathy is still the most common of all the complementary care that anybody does in this case. In a typical Italian complementary medicine user are adults aged 35 to 44 with post-high school qualifications, and 2/3 of them are women. There's more, because I found some of the stats extremely interesting. Not that I didn't know this stuff, but I found it extremely interesting. That it was a 13-year study. They studied 180 different diseases, okay? 180 different diseases. So part of it said no negative effects resulted from the use of homeopathic medicine in pediatric patients. So now we're talking about the pediatric part of the study. And it said that improvement of symptoms were 74.1%. And it said only 3% of the children did not benefit from homeopathic medicine. Come on, the results are there. There's proof that homeopathic medicine works. Let me see. Okay, effectiveness of homeopathic treatment. So this is in another aspect of it again. A total of 20% of patients reported, and I believe this was within a total of 395 patients. 34% were men, 730 or 65% were women. A total of 20% of patients reported that the complaint had been resolved. 27% had experienced a significant improvement. 22% reported a good improvement, and only 0.5% of patients experienced